I'm sorry.
I'll take up the whole desk.
I've got plenty of desk over here. Actually, I'm pretty solid, so good.
There we go.
Okay. Well, we think we're live. It's the first time we've been back on YouTube in a long time, but we didn't have some of the grief that we had with Facebook last week. So, yeah, we'll hopefully this goes well and we can continue to go live here on YouTube. Of course, we will push this to all the platforms, including Facebook, but you can find our podcasts anywhere you get podcasts,
Right.
Anywhere and everywhere. Spotify, Google Podcasts, Pandora, Apple. Yeah. So,
all.
pretty much everywhere. So if you would please, would you leave us a comment on YouTube or Facebook or a share? That always is helpful for helping to spread what we do. And if you're listening to this on podcast, please just scroll to the bottom of this episode, give us a rating. It does not have to be anything more than some stars, or give us some feedback. Let us know what we can do better.
Or suggestions. You know,
Absolutely.
I mean,
topics.
you come up with all the research, or you don't come up with it. You get
No.
it. You find it. It comes out, and some is quite new.
Including today's study.
But if you have suggestions on or questions, you can always search and find the research.
Yeah, we're at well over 100 episodes now of this podcast, and there's a lot of topics we've covered, but there's some that we haven't, and that's a testament to how many studies we have on light and laser therapy. There's over 6,000 studies that have been published now. Over 100 this year alone have come out. So
It's in the coffer.
yeah, that's for sure. The coffer, that sounds more morbid.
Oh, no, not coffin. Coffer. That's a word.
Oh, you're right. Okay, yeah, all I could think was coffin. Oh, that sounds...
No, coffer. It's a receptacle or something.
Yeah.
I could be wrong. I could be using wrong terms.
Let us know.
Yeah.
You have to prepare yourself for the feedback there, Christy.
Okay.
Okay, so let's get started with today's content, though. We're going to be talking about Alzheimer's disease. It's a neurodegenerative disorder. We're going to talk about what it is. We're going to be referring back to a study that came out in January of this year, January 2024, in Photodiagnosis and Photodynamic Therapy Journal. The paper's title is Photobiomodulation's Potential as a Non-Invasive Therapy for Alzheimer's Disease and Minimal Cognitive Impairment, a 12-week investigation. This is an Iranian study, which they have been producing some level of research for a long time now. It's a small study. We're going to break this study down and talk about what it really means, because from the first word, it can be a little bit confusing, right? Photobiomodulation. So let's just do a little cheat ahead here on that. Right. Photobiomodulation just refers to modulating the biology of the body by using light, photo, right? Many different forms of light can be used. So we're talking about using light therapy for Alzheimer's disease to show some level of cognitive improvement. So you can get this whole study. Actually, it's an open access study. You can look at the research itself. We'll link it, of course, as usual. But we're going to break that down, hopefully in a way that makes a lot of sense. So before we go any further, introductions. If you're joining us now for the first time, or the first time in a while, and you've forgotten who we are, this is Christy. She's a certified laser tech. I'm happy to have her with me so I can have someone to talk at. Christy helps give me some direction, thankfully, and ask the questions that you're probably thinking too, which is really handy. And then my name is Jason Roundtree. I'm a chiropractor and certified medical laser safety officer. I'm the founder of LTI, and what our job is to do ultimately is to help train doctors on how to use light and laser therapies in their practice. We also secondarily want to help spread the word about what laser therapy can and can't be used for, so that more and more patients are aware of it. Because if you're struggling with something like Alzheimer's disease, it is a pretty hopeless process.
Well, and even the caregivers it's nice to at least see something that could offer some hope.
Right. No, absolutely. Yeah. It's maybe sometimes even harder on the caregiver than it is on the person dealing with dementia. So let's talk about this then. So with Alzheimer's, what is Alzheimer's disease? Well, it's a neurodegenerative disorder that impacts the brain, leading to cognitive decline that worsens over time. Cognitive decline means things like memory issues, recall problems. Also, though, anxiety and depression. Those very, very common with Alzheimer's disease. They say that Alzheimer's disease is quickly becoming the most prevalent age-related dementia across the globe, with its incidence skyrocketing faster than any other. Reports suggest the disease has affected approximately 15 million individuals worldwide, but by 2050, Alzheimer's is going to affect 13 million people in the U.S. and 16 million in Europe. So it's going to more than double.
Well, I'm just from personal experience, I'm seeing people younger and younger with the disease. It's not an old person's or an elderly disease anymore.
Correct.
It's affecting people much, much younger.
Yes, you don't have to be 80 to get this. You don't have to be 70 to get this. We've got people in their 40s.
40s and 50s.
Yes, that are going into this neurodegenerative pathway with Alzheimer's and early onset dementia, which is related.
Right.
So it's something that we should all really be aware of and concerned about to some degree. There's not a lot of good testing for this. There are some genetic tests that might be useful. If you're concerned about your risk for Alzheimer's, there's some genetic testing that's fairly affordable that can tell you how likely it is that you're going to struggle with this. And the reason that it'd be good to know that is that the earlier you can catch this, the more effective therapies can be.
Right.
So you can be on the lookout for some of the warning signs, because the only other way to catch this is once it's very advanced, to get an MRI and you can see some of the changes in the brain. But it's too late to really do much at that point once you can see those changes. So the earlier you can catch this, the more prevention, I should say, that you can do, the better. There's two real mechanisms that they called out in this paper of how Alzheimer's really affects the brain. Number one is the formation of plaques of amyloid beta peptides, which induces synaptic and dendritic dysfunctions. That means cellular changes in those nerves. And that can lead to the activation of microglia and astrocytes, consequently triggering an inflammatory response. So Alzheimer's has an inflammatory component here. Some folks say that the inflammatory component is really what induces the formation of these plaques. And now you can see that with high blood sugars. High glucose seems to be able to trigger that, to the point where some researchers are calling it diabetes type 3.
I was just going to say that sounds a lot like diabetes.
Exactly. We know that diabetics with high glucose numbers have a lot of significant inflammatory conditions that can go on. Healing is impaired in all tissues, eyesight loss, neuropathy, and, peripheral neuropathy, but also central nervous system effects. The second mechanism that happens is intracellular neurofibrillary tangles, or NFTs, and not the NFTs like all the kids are buying on the internet. We're talking about instead of normal functioning nerve pathways, you have a tangle process, which of course impacts the way that those neurons can connect, can function, and that is followed by cerebral atrophy. The brain actually does shrink. So those two mechanisms can be seen, but again, they can be seen in the later forms of the disease. Early on, you can't visualize those. That stuff is probably happening, but it's not happening in a way that you can really see on imaging. And so by the time you can see that, it's already very progressed. So that's why they went into this study. This study, they wanted to look at using light therapy for Alzheimer's. And this is far from the first study that's been done here. So this study really adds to some of our knowledge about light therapy working for Alzheimer's. And we actually have a lot of studies that show it can work quite well for Alzheimer's.
I think we've done a few of those.
We have.
So.
Yeah, and we're going to keep doing them as we see more and more research, because the more we learn about this process, the more hopefully productive it can be for patients, for those that are dealing with that, or for preventing the decline.
Well, and with the widespread, it seems like you're hearing about it all the time.
Yes.
So if we can catch it.
I think we're going to hear about it more and more too, as we go, because you're going to see more celebrities that are affected. Unfortunately, there's not really a way to avoid that.
When we hear about them more,
you're going to hear about them more, right? And then it's going to be affecting more and more of the family members. And the more that folks age, the more people it's going to affect too.
Right.
So in this study, they used LED light therapy, and to just break down how it works, essentially light can pass through the skin, and some types of light can pass through the skull and actually be absorbed in the brain. And the mitochondria in the cells absorb these particular types of light, these photons, like a dark t-shirt absorbs sunlight, soaks it up, gets warm, right? That's an energy type change, but also in the mitochondria, you get a conformational change where proteins can switch on. That protein is actually called cytochrome C oxidase, and activating it increases the activity of the respiratory chain in the mitochondria, which produces more energy, maintains cell balance better, and promotes cell vitality. Then, and this is interesting, then photobiomodulation, the application of light, also increases the level of the cytochrome C oxidase protein, which is the target of light, so you get even more of it, and that enhances the effect of future light therapy. So it creates it creates a better target for additional photobiomodulation, which is why we see repeated applications of light make a much larger change than a single standalone treatment. Which is why if you go to get laser therapy done, nobody's going to say, let's do one and then you can be well. It is very effective, but it becomes more effective the more you do.
It's ongoing. It doesn't just stop once you...
Right.
I mean, it continues at a certain level.
Yes.
And so there's continuing improvement.
Yes. It has multiple days of effect. It's not just having an effect while you apply light to the tissues. It has an ongoing effect afterward, but then a cumulative effect that the more you do, the more you get out of it.
That's the word I was looking for.
Cumulative? Yeah, it's a good word. They go on to say that photobiomodulation, or the application of light to the tissues to have a positive effect, they say it has demonstrated a capacity for mitigating inflammatory response, which we already talked about, inflammation for Alzheimer's, as well as curbing the effects of oxidative stress and apoptosis, or cell death, which is induced by those amyloid beta plaques. Additionally, this form of treatment has shown promise in restoring cognitive behavior and improving mitochondrial function. So really, we're working on the root causes of what's going on here. Now, you might not reverse it completely, but you're attacking what's really happening instead of addressing symptoms. And that's why you see improvement. You're not trying to improve symptoms, you're improving the root cause of what's going on, which again is why it's important to get to this quicker rather than later. Because yes, you can undo some level, it appears, some level of this kind of cognitive decline that goes on. But if it's in the early stages, you're going to be a lot more productive. So, and this sounds really exciting.
It does.
I mean, yeah.
You know, rather than throw a medicine at it with side effects.
Right.
So.
Right. And if we had a good medication for Alzheimer's, that would even be an option. But right now, we really don't. We have the few medications that we have are barely effective. They might slow down the progression. They don't even stabilize the disease. They might slow down how fast you're getting bad.
Right.
Maybe.
Right.
Maybe. And they're insanely expensive. It's $5,000 a month for Aduhelm, which is an infusion-based therapy that, again, doesn't even improve people.
No.
$60,000 a year that taxpayers are essentially footing the bill for something that doesn't even work.
Mind-boggling.
Yeah. So that just leads us to, well, why isn't everybody doing this instead, right? Well, we're very, very early in the science behind this. And even though laser therapy has been studied for decades now, even though it's incredibly safe, we still need more studies, which is why I want to encourage any researchers that might encounter this podcast to say, keep doing the studies. Definitely. We're going to be critical on your studies a little bit, of course. However, we appreciate what you're doing.
Definitely.
We need to see what works. We need to see what doesn't work. So keep doing it. Now, let's talk about this study, because they did set up a pretty decent study, I think, but there's a couple things we'll talk about that we should be aware of when we're talking about these studies. So in this particular setup, they had 13 patients. 6 of them had an active treatment, and 7 of them had a sham treatment or a placebo treatment. They had daily light therapy treatment sessions for 20 minutes, or at least 6 times a week. If they could skip a day if they needed to. And they used an 810 nanometer LED. They say in the paper, the best wavelengths for deep tissue penetration in Alzheimer's light therapy are 660 nanometers, which is red light, and 810 nanometers, which is infrared light. They say the equipment should allow for doses of more than 60 joules per centimeter squared, which just means it's bright. And you need a lot of light to get to those brain tissues. So the treatment group, the 6 patients who had active treatment, used an LED device that had 4 810 nanometer LEDs, the infrared. And they put one here on the frontal, one on the opposite side of the frontal, and then one kind of on the back side of the head, the parietal area. So 4 LEDs total. Now the sham group, the placebo group, they used the same type of setup, but instead of the infrared LEDs, they used 660 red LEDs. Which, if we go back just a minute ago, didn't they just say that red, the 660 red and the 810 infrared are the best wavelengths? So if you've got a sham or a placebo, it's supposed to be like a sugar pill, right? It's supposed to not really do anything.
Right.
They actually set this up with a wavelength that probably did something. Which seems like an odd choice.
That seems like an odd choice.
Couldn't they have just turned off the infrared LEDs?
Isn't that typically what they do in a sham?
Usually, yes. Yeah. So I thought, that's odd. Let's see what the results are. Because not only are they using kind of maybe an effective sham, but also they're using some pretty weak light sources here. These are not high power lasers. These are low intensity LEDs. So those are a couple of the issues that I saw with this particular study. So let's talk about the results and see if they really were issues. So for the treatment group after 12 weeks, so 3 months of daily treatment, did have significant improvement in cognitive testing.
Okay.
But so did the placebo group. Not a significant amount, but some level of improvement.
It's because it wasn't a true sham.
Maybe it wasn't, right? Yeah. So they go on to say that in contrast to the majority of prior research, so this study, comparison to prior research, our study did not find a significant improvement in anxiety levels. Well, I wonder why. Maybe it was weak LEDs. They say both the group receiving the light therapy and the control group did show a substantial improvement in depression.
Interesting.
That is, yeah. So was that true placebo? Or was it maybe that both types of light, the red and the infrared, had an effect?
You would almost think so.
Probably.
Yeah.
Kind of interesting.
Yeah.
They said patients without treatment, or those who had the sham, the quote-unquote placebo, did exhibit a worsening functional decline, while those treated with the infrared light showed an improvement in their functional status. So let's recap that. The group that had infrared light did have quite a bit of cognitive improvement, a good bit of improvement in depression, and improvement in function. But they did not have any improvement in anxiety. The group with the red light placebo, shall we say, had a little bit of improvement in cognition, no improvement in anxiety, but did definitely have good improvement in depression. But they did have worse functional decline. So kind of a mix and match. It's kind of confusing. Yeah. Now, some of this may be because it's only 13 patients in this study, so it's a little bit harder to draw conclusions from a small group. But I think we had some effects with the red light. I think we definitely had some effects with the infrared light.
So that, to me, would say both work together?
Both could work together, yes. That's what we see with some of the most successful studies on Alzheimer's, that we're using multiple types of light, multiple colors of light, if you will, of infrared, of red light, and seeing some really positive outcomes. So they say, in summary, our study cautiously indicates that photobiomodulation may offer potential benefits for improving cognitive and psychological aspects for patients diagnosed with Alzheimer's disease. And I would agree. Yes, it does. It's not a great study as far as really a sham controlled, because I think they kind of goobered up their sham here.
Yeah.
However, it's another data point.
Well, and it shows that multiple wavelengths, colors, can be effective because they target tissues differently.
Yes.
They target things differently, and each one has its pros. Well, I don't want to say cons, but they work more
Yeah.
effectively than others, but together they would almost work
Yes.
the best.
That is really what we're seeing from a look at kind of the combined research effects, is that, yes, multiple different types of light can have effect. Higher power true lasers seem to have more effect than lower power LEDs. So, yes, really, in general, I think we can say that light therapy does seem to help Alzheimer's disease patients. Even if it's not perfect, it seems to be a positive factor. Also, red light probably has a good effect. Maybe not as much as infrared, but it's not necessarily a placebo treatment.
No.
And then, lastly, these guys did treat for 12 continuous weeks. That's a long time to go with treatment before you really see some results. So keep in mind, if you're getting light therapy for something like dementia, Alzheimer's, it's going to take time. It takes time to see the changes. It takes time for the body to build up that cumulative effect where it's an obvious change. It's not an overnight success. So give it time. See if you go in the right direction. The research says most people will. So is it worth a shot? It is.
Definitely.
If you're looking for light therapy, I'd encourage you to go to our website, lasertherapyinstitute.org. You can find our clinic map there. You can look at those who are near you performing light therapy, then give them a call. Make sure they actually can perform it for what you're looking for. If you have issues with that, you can email us to info@lasertherapyinstitute.org. Let us know if we can be of help. I think, this is not an FDA cleared procedure, but I think we're going to see more and more research affirming the effects of light therapy for memory. And I think we're going to see more and more people benefiting from it in the very near future.
Yes.
Cool.
It's worth a try.
It is. It is worth a shot.
Worth a shot.
Thanks for joining us today. We'll be back here on YouTube live in about a week. And, of course, catch the episodes wherever you get your podcasts.
Yes.
Thanks.
Thank you.